Welcome everyone to this AWS presentation on healthcare's next big transformation. My name is Anne O'Hanlon, and in my role as a product director at Orion Health, I'm responsible for two products, our analytics software, which is called Discover, and the digital front door, which is the topic of today's presentation. Joining me today is Trevor Delany, who's the Chief Digital Officer at Southern Cross Healthcare, and we're working together in a co-dev environment to enhance the digital front door to support their customer engagement strategy. We're introducing a way for patients to digitally interact with their hospital staff, with an initial focus on patients who had been admitted for elective surgery. It is my hope that when you leave the session today, you'll have a better understanding of why the healthcare industry has been slow to implement consumer engagement platforms and what the main challenges are, particularly for hospitals. We'll explore Orion's solution for consumer engagement, which we call the DFD, and I'll show you what this looks like as a patient who's preparing to be admitted for hospital. For those of you a techie in the audience and like to see under the hood, I'll walk you through the solution architecture, and then I'll hand over to Trevor to talk about why consumer engagement is so important to their business and the benefits of migrating to the AWS cloud last year. And I'll conclude by sharing my thoughts on the benefits that we as Orion have achieved by collaborating with AWS. So those of you who know Orion will know that we're 100% dedicated to healthcare market. You may know us as the company behind Amadeus, which is a best-in-class solution for health information exchange. And we're currently developing our next generation HIE solution, which we call Amadeus X. And this builds machine learning into the core of our health data platform. And our goal is to provide the right patient with the right care in the right place. And this means flipping the model of care upside down so that we bring the hospital to the patient through technology, rather than making the patient come to the facility all the time. Now, the type of transformation we're seeing, we believe, is a once-in-a-generation event, propelled on by the pandemic. But there have been a few key pivotal moments in healthcare over the last 250 years, beginning with the invention of the smallpox vaccination in 1796. We name our meeting rooms at Orion Health after key figures like Edward Jenner, because it reminds us of the massive contribution they have made to the advancement of healthcare, and it inspires us to keep aiming high. Our mission at Orion Health is to revolutionize global healthcare so that every individual receives the perfect care for them. And that is what each of these famous pioneers did for their generation. In fact, one doctor actually told us he thought his HE was the best invention since the stethoscope. But I feel we still have a long way to go to truly bring healthcare IT into the 21st century, particularly for consumers. It's hard to believe, but Trevor was telling me last week that it took over 100 years for the stethoscope to become part of mainstream clinical practice. And whilst early adopters have been doing consumer engagement for a few years now, and patient access is pretty commonplace in primary care, the hospitals are still way behind. So I think it's fair to say that healthcare has a customer experience problem. So I remember the time that I once went to an appointment, and it was on a Saturday, and I was sitting in the waiting room, and I was the only one in that waiting room. And I waited for over an hour. And then I realized my car park was running out. So I went back down to the receptionist and I said, look, I've got to go and put more money in the meter. I'll be back in a few minutes. And she said, oh, but I'm not the receptionist for the doctor you're seeing. And then I realized he didn't even know I'd been waiting the entire hour. And I felt so mad. Now contrast this with the experience that I have doing my click and collect weekly supermarket shopping. So I do the shopping online and they text me, and you can see the link there. I can follow that link and I can tell them I'm getting in my car, I'm on the way. And then when I get to the car park, I can press a button on that webpage that tells them I've arrived. So that by the time I get into the store, there is my set of groceries all ready to take home. And that's what I call convenient. And convenience is what drives consumer engagement. Now, thinking about elective surgery in New Zealand, if you were one of the 80,000 people who had an operation at one of Southern Cross's hospitals last year, you would have been given this pack of paper forms to fill in at home and post or email back to the hospital. Now, I can't think of any other business that expects me to fill paper forms in anymore. Even the mechanic who serviced my electric car emailed me a link to a Google form. And yet hospitals still give their patients paper. When we spoke to hospital staff who received these forms, they said most people actually take a photo of each form and email those as attachments to the hospital. So you imagine being the hospital staff, you've got all these emails, all these attachments, you've got to open every single one. And apparently one patient actually put every single piece of paper on their kitchen table, stood on a chair and took a photo from the top and sent the one photo to the hospital. But they forgot to turn the paper over and photograph the back of each piece of paper. So the poor staff who's in the hospital is trying to figure out what information is missing. And it sounds really inconvenient for everyone involved, the patients and the staff. Plus, it's expensive because it costs between $6.5 and $7.5 New Zealand dollars plus postage per pack of paper forms just to print them. So we figured that with Southern Cross, we could save over $285,000 US per year just by not printing anymore. So what is the solution to this problem? How do you fit over 150 questions into a smartphone-sized screen without the patient giving up in despair? So we ran several co-design workshops with staff at Southern Cross, and they interviewed patients to come up with a user-friendly way of collecting information. And this is what it looks like. It's quick and easy for the patient to go tap, tap, tap from the comfort of their sofa, on their phone or their iPad or tablet. And their overall goal is to make the process of going into hospital much less stressful for the patient. So once we had the design agreed, the next stage was to get everyone thinking differently. Trevor likes to call it thinking from the outside in rather than from the inside out, which is what hospitals have historically done, because they've been focused on clinical systems and what happens inside the four walls of their buildings. But consumers have different expectations, and these are influenced by their experiences of things like online shopping. You can't control what device they own. You have to cater for a wide range of accessibility needs. And so we've designed our solution to be device and browser agnostic. And gone are the days when you can force consumers to log in over a VPN because you want to keep their data safe. Now we give them the option of keeping their accounts secure using two-factor authentication. Dynamic scaling is another facet that we've built into the solution, so that if the analytics is showing us that demand is higher than we'd anticipated, we can rely on AWS to automatically adjust server resources. And lastly, to help us define the scope for our first release, Trevor coined the term MLP, Minimal Lovable Product, rather than what we usually call it in the industry, which is MVP, Minimal Viable Product, because we felt that better reflected what we were trying to give our consumers, a product they would love using. And that helped us decide where we were getting the balance right to go live with the functionality. So here's a typical journey for a patient who's been admitted for knee replacement surgery. One of the reasons I think hospitals have been slow to adopt consumer engagement platforms is because these journeys are so complex. It's not a single interaction. There are many steps that have to be highly coordinated. And it's also not sequential, although you don't get that sense by looking at this diagram, because what you're seeing here is the happy path. Things frequently happen out of order in healthcare or in parallel. And we want the patient's experience to be cohesive and coordinated across a long time frame. And that's what makes it challenging. You know, up to 10 years after they've had their surgery, we want to be collecting outcome data from them. So right from day one, we put a lot of emphasis on getting buy-in from all the different representative stakeholder groups, because this referral and booking and admission process, it touches all of them. And of course, the more people you have involved, the higher the risk of medical errors creeping in, which results in potential harm to the patient. And we all know that the first rule in healthcare is first do no harm. So we brainstormed all the potential hazards and things that might go wrong, and then we established mitigations in the design or the change management process to address each of these, because healthcare is a highly regulated industry. We've also designed the system to cope with unpredictability, and flexibility was a big theme that emerged out of our co-design workshops. We documented real-life use cases shared by doctors and nurses, and then figured out what their unwritten requirements were. So, for example, we met with some orthopedic surgeons, and they said if a patient had carpal tunnel syndrome in both hands, and they'd planned to operate on the left hand, quite often, by the time they got to the hospital on admission day, the right hand was causing them more pain than the left hand. So they decided to operate on both. And that might have a knock-on effect for everybody else who has been operated on that day. They might have to notify everybody to say, please come in a few minutes later. So we added new functionality for the nurses to be able to send out those notifications. Variation in clinical practice and the scope of services offered is another area that makes it really hard to make consumer engagement technology work in healthcare. We have this challenge that every clinician or every clinic has their own way of working. And I've heard doctors share completely opposite views on what is considered best practice. So thinking about that orthopedic surgeon again, he said it was best practice to wait until the day of surgery to get informed consent from the patient about exactly what procedure they were doing. Whereas if you talk to a cardiologist, he'll say best practice is to sit down with the patient at the very first initial consultation and get the informed consent then and there. So these differences are often due to which specialty the doctors practice, and we solve this by deliberately engaging pilot users from a wide range of specialties. And we ask them to validate our assumptions so that the configuration we landed on was sufficiently flexible to cater to all of their needs. And there are also a large number of edge cases. In fact, there's numerous what-if scenarios. What happens if the patient doesn't have an email address or a mobile phone number? What happens if we don't know the date of surgery, so they put in Christmas Day as their temporary date? What happens if the patient needs an interpreter to be able to fill these forms in? We can't simply ignore these and hope they'll magically go away. We have to build the product to cater for these scenarios. And we use test-driven development to validate that we'd addressed them sufficiently. So how was the solution built? Well, we worked closely with AWS to migrate Southern Cross Healthcare to the cloud before we built the customer engagement platform. First of all, we moved their existing system, which they call Clinical Workstation, which consists of our Amadeus and Coordinate technology, into the cloud. And this runs on EC2 instances using Amazon RDS as the backend database platform. And everything runs inside of VPC with VPN connectivity to interface the external systems and the internal systems from Southern Cross to the cloud. Of course, there's load balancing, and we use services like CloudWatch for monitoring, and all sorts of great security related services like Secrets Manager and a raft of other things that aren't here on the diagram. But that gave us a solid platform onto which we could loosely couple the DFD so that we could begin rapid prototyping. So at this point, I'd like to introduce you to Trevor Delany, who's the Chief Digital Officer at Southern Cross Healthcare. Welcome, Trevor, and thanks for joining us. Can you start by telling us a little bit about your business and why customer engagement is a current focus for you, and then maybe some of the benefits of migrating to AWS?
Thank you, Anne. You and your team have really demonstrated that you have been immersed in this journey with us. So about Southern Cross Healthcare. We are the leading comprehensive private healthcare provider in New Zealand and have an extensive national network of facilities and providers. In saying that, we are transitioning from a hospital-centric business to a wider connected services model, acquiring adjacent and related businesses of rehabilitation, community nursing, and wellbeing. Our overall mission is to lead the transformation of private healthcare in New Zealand at a time of significant flux in the health environment. So what are we doing? To create such a leading organisation requires many significant changes. Two immediate and persistent changes include a shift of our core technology to cloud platform models for scalability and extensibility, a shift of our value lens to that defined by the consumer from our traditional internal supplier or provider lens. Partnering with Orion and collaborating with AWS is critical to us achieving this. In particular, we have recently migrated our core clinical platform into the AWS cloud, and we are now building our customer engagement platform within AWS. Doing so gives my business resilience, flexibility, and access to modern tools and services. Of particular focus for us at the moment is to dramatically improve our customers' digital engagement experience with us. Our current booking management admission journeys are incredibly onerous for our patients, doctors, and admission staff. They are riddled with issues that we've tolerated and worked around for many years. With Orion, we're building our first generation customer engagement platform to digitize these journeys. Not just the technology, but the thinking is a fundamental shift for us too. Thinking and behaviors that include human-centered design, design thinking, immersive consumer and specialist engagement, and a significant self-challenge to unpick the decades of process concrete. After all, as providers, we are also consumers, and we all know modern digital experiences provided by ride-sharing platforms, airlines, financial services, and even pizza delivery. Some of the benefits we're currently chasing include faster and easier information to supply to our customers and our hospitals, proactive and timely engagement through reminders and alerts, improved data security and privacy, and reduce costs not only for us, but our customers. Simply put, what we're going to deliver is a well-orchestrated series of great experiences, aren't we, Anne?
Yes, we are, Trevor. And for Orion Health, the benefit of working with AWS is that it's consistent with our direction of travel from an R&D point of view. So we can leverage purpose-built tooling for automated deployments. We have shorter lead times to be able to stand up new environments to undertake activities like penetration testing. And it's really easy for our staff anywhere in the world to be able to support that infrastructure because it follows a standard reference architecture, no matter what region of AWS the customer is located in. So less time spent on infrastructure means more time developing product features. And ultimately, this means we can innovate faster to make life more convenient for patients. So I'd like to say thank you to Trevor for his time today, and thanks to AWS for inviting us to speak about the Orion Health digital front door. But most importantly, I'd like to thank you, the audience, for attending this session. And if you'd like to know more about anything we discussed today, please get in touch with us via the Orion Health website.